Now we proceed to our open forum. If you have any question regarding the lecture, you may write it in the chat room. I have two initial questions here. Let me share. So can you see it, Dr.?
Yes, I saw it. How do you combine diseases differentiation with DCM syndrome differentiation? Okay, to answer the first question, we have to know what is the purpose of the patient, what they want, what problem to achieve first. Okay, so that's our main concern first. Then we will also see what are the other symptoms they have. Then we make them a treatment plan. So the second question, how is your experience between acupuncture, tuina, and herbal medicine cervical? Okay, tell you frankly, okay, we cannot do, okay, or we don't like to do treatment on cervical spondylosis without tuina application. You may treat them without acupuncture or herbal medicine, but definitely we suggest to do tuina manipulation. Tuina manipulation, actually, it's not painful at all. The patients will feel very at ease. Instead, after the treatment, they are also have the feeling of like to come back. Okay, so for those patients who are mild enough, we can only just perform the tuina, okay, just on the tuina. But it would be best if you apply other modalities. You can include acupuncture, which will further, okay, facilitate the repairing process. And then for herbal medicine, actually, for youngsters who have very body immune system, actually herbal medicine is just only a supplemental modality to the treatment. So the main treatment method for cervical spondylosis in a clinic is tuina, okay? And herbal medicine is only recommended if, okay, we saw them having several sessions, then not as what we wanted. So especially for those people whose body is very easily to catch cold and dampness. So if they easily get cold and dampness, it will keep on having stagnation. So we will recommend them to take also herbal medicine as well. So are these questions answered properly and satisfied to the one who asked the question?
Yes, I think so. So to summarize, tuina seems to be the preferred modality.
Yes, as what I mentioned a while ago, in Yizhong Jingjie, okay, it's already mentioned. Okay, for bone diseases, tuina, okay, is the best modality.
Thank you, Dr. Chua. To follow up, Nolan asked regarding Zheng Gu Shui.
Yes.
So, do you recommend using this during tuina?
Okay, for us, we don't use Zheng Gu Shui in our tuina. We just use baby oil for lubrication. It's more on the technique of your hand manipulation rather than Zheng Gu Shui. But Zheng Gu Shui, it helps. Okay, helps. For example, if we have patients who cannot use the moxibustion, such as having problems on their finger, they have trigger finger, okay, or tendonitis, of course, sometimes we will recommend them to buy from Chinese drugstore the Guangxi 这个正骨水，what's the brand name? Yeah, 正骨水, that's the name. 广西出产的 okay, manufactured from Guangxi.
So, are you saying you just need to use baby oil? But
yes, for lubrication, for easy manipulation. in our clinic, we never use this kind of liquid herbal medicine. But sometimes we will use also recommend the zhangjiu, okay? But not on the inside the clinic, but afterwards when they go home, they can use the zhangjiu, okay, which is also a kind of moxibustion application.
Dr. Chua, can you write in the chat box, or so maybe other people can, the herbal oil that you said that you recommend to patients to use when they go home, but during your tuina, you're saying baby oil is enough.
Okay,
so
I'm sorry, I don't know how to use the
it's all right. Maybe
in
later.
Chinese. Okay, maybe I think I would like to ask Dr. Cheng to help me. Zhangjiu. Maybe Dr. Cheng can help me on that. Favor, please.
长灸 is it
长灸长灸叫做经络长灸，经络长灸。
But meanwhile,
头长的长。
Lloyd is asking, does warm compress help?
Okay, that's a very, very good question. In our clinic, when we treat musculoskeletal problems, with so many patients, they do warm compress, okay, by their own. But if you don't have other applications when you are having so much pain, then ordinary heat compress is advisable. But we often see after the heat compress, when the patients come back, we saw a thick layer of dampness on the superficial area. So as much as possible, do not do hot compress, but rather, instead of doing hot compress, you use moxibustion. So moxibustion has the ability to penetrate deep inside our meridians, while hot compress is just only on the shallow area, but it can, of course, facilitate blood circulation. But afterward, okay, the problem will come back.
So can I repeat? So you're saying if we use a warm compress, or do you say there's a dampness side effect if you use the
afterwards, because after the hot compress, your skin on the superficial area will the pores will open, right? So once you leave that, then even you are so much protected, the pathogens on the atmosphere will easily penetrate. So you will have a layer of thick pathogens on the superficial area. So, but if you don't have other choice, you can do that, okay? Just for temporarily relieving the pain.
Thank you, Dr. Chua.
Yes.
Another question. What's the main function of Guizhi and Geken in this prescription of
yes, okay.
And after Tuina, before Tuina treatment?
Okay, Guizhi and Geken, okay, Guizhi has 3 functions, okay? First, it elevates our energy, okay? Then it has the ability to dispel pathogens, okay? And it gives energy, strength to the body. And Geken has the function of releasing muscles and expelling also pathogens. So when these 2 comes together, they will induce an effect of treating cervical spondylosis, which we often use as main ingredients when we come to prescribe herbal decoction.
Okay, thank you for that information. And then, do you recommend any stretching or exercise?
Okay, when there is pain, we always prohibit our patients to do any stretching. Our theory is totally different from physical therapy. In physical therapy, they always okay, your objective is to facilitate the blood circulation, right? When you do stretching exercise, okay, it will facilitate blood circulation. So the problem area will get eased afterwards. But before it get eased, you stretch that, you tear the soft tissue again. Okay, so just like bone fracture, orthopedic doctor never will say, okay, after the casting, you go for what? For keep on walking in motion to facilitate healing. No, but we always tell the patients, stop, okay, performing this manipulation, this activity first. Then when you have no pain at all, then that's the time you do strengthening. So we always tell the patients doing the right thing at the right time.
Yes, thank you. Then how about, so you didn't recommend the warm compress, but how about the TDP lamps? If we don't have MOXA.
Yes, the purpose of the TDP lamps application is try to substitute moxibustion application. It has effect, but the effect is not as good as moxibustion.
I don't know if you know about Ting Tong granules. So Joyce asked, Ting Tong granules for cervical spondylosis due to Qi stagnation and blood stasis.
Sorry, I never used that also, so I don't have any idea.
And then follow up on the warm compress. So
Yes.
you said it opens up the body to the invasion of pathogen because the pores is open. But will Qigong help? So the question of Doc Mike is, will Qigong help maybe strengthen the body to protect itself from the opening of pores?
Yes.
Is that right, Doc Mike?
Yes. If you can reach to that level.
I see. Okay. High level of Qigong. Are you saying
yes.
She's not Qigong?
Yes, yes.
So it's not an honor. And then Alma is asking, how about if we just use like a pain relief patches like Salompas?
Okay. Salompas will give you a very pleasant feeling due to the coolness. But I never saw a patient get healed through that. Maybe he put the Salompas, then he get healed. It's due to his own body repairing system that makes him better.
Thank you. Well, there's a follow-up question. How often do you recommend treatments for patient? Is once a week enough?
Okay, depends. Okay, depends on the severity of the patient's condition. Usually in very mild cases, we do just only 1 or 2 sessions. Okay, and for serious, maybe longer. Okay, it depends on the seriousness. There are also, I have patients in years because they are already totally paralyzed at all. Okay, so in normal situation, if they need to come back, okay, it's either after today's treatment, they come back after 4 days. Okay, and if not very serious, okay, maybe once a week, but try not to exceed more than once a week because it's we need continuity. Okay, it's just like accounting, consistency.
Thank you. Okay, there's a follow-up question. What about vents and, oh, sorry, I cannot. Amy, would you like to turn on your voice? Ventosa and guasha. Oh, ventosa and guasha. How about ventosa and guasha?
Yes, it helps a lot. Okay, the easiest to dispel out the pathogens is guasha and ventosa. That's why we often, okay, have this, okay, included in the initial treatment. So because, okay, let me explain this scientifically. Okay, our body is prone to absorb pathogens such as wind coat and dampness. So, okay, scientifically, okay, our pores open, the body cell will absorb these items. then we have to let them out first, okay, before they entering in the deep inside the body. So while they are still on the superficial area, we can use the guasa to dispel out. That's why you can see those red rashes. Actually, it's called pétachier. So these are the pathogens that have already excrete out. In Western medicine, they said these are the ruptured blood vessels. It's not, okay? If you don't have pathogens on the superficial area, no matter how hard you scrape it, nothing will happen.
Thank you very much. That would be
Welcome.
our last question.
Yes.
I think the open forum really enriched the lecture. So thank you for the participation, everyone.